Well, I think that segues nicely into the next speaker, which is Karen Lennon from WA Health, and Karen's from the Quality Improvement and Change Management Unit. That's right, isn't it, Karen? No, it's totally not right. I'll just let Karen introduce herself.
Thanks, Pip, and good afternoon, everyone. And thanks to Pip and the Health Consumers Council for organising such a wonderful event on patient experience. So my presentation is very different to Lorraine's, as you may expect. I sit here very much with a government bureaucratic hat on, which is my current role. But I want to let you know that the Karen Lennon you see is also a clinician. So I have a background as a physiotherapist. I've been a clinical service manager, and I'm also a consumer, both for myself but also for my two children who are rather older now, and I'm encouraging them to be their own health consumers as they grow and develop into that role. So it's always complex to think about how you sit and how you're speaking to people when you've got so many hats, and I'm going to try and share some of those hats with you today. So I do produce report cards. I am a bureaucrat, and that's part of my government role. I'm going to explain to you how that role works currently within the health department. So I manage a unit which is a sister unit to the Quality Improvement and Change Unit, which is called the Patient Safety Surveillance Unit. And I've worked in that unit since it was established in 2012. But safety and quality from the Department of Health has been working since the early 2000s, so a much longer journey, and I'm a recent contributor to that journey. One of the things that I've been able to do in that time is to coordinate a project to implement across health a combined patient feedback database. So we collect the patient feedback that is contributed by consumers, and we do produce reports, and those reports have components that are both the data, because we're talking about how do we measure this afternoon, but also the stories. So whenever we produce data, it's important to remember that those aren't numbers, those are people's experiences. And so we use case studies or patient stories to help with the richness of the opportunity of the information that's being transferred, because numbers alone don't tell those stories. One of the things that new database has done, and it's a database that's used internationally called Datix, is to allow us to take all the feedback that our consumers provide to us across WA Health and to enter it into one data repository that can be seen at the local level, so at the hospital, but also at the health department level. So if there's a complaint that occurs at a local hospital and someone needs to find out what the health department's view is about that, then I can facilitate that through my unit. So that information, instead of being seen locally, can be viewed at the top level for the Director General as well, and changes can occur both at the local level and at that higher level within the health department. So that new database has been in place since the end of 2014, and it allows an opportunity for people who work in liaison roles and other clinicians to enter information into the database associated with the feedback that we receive. So not so much surveys, but more the other complementary tools that health uses, which is a range of things. So it could be that it includes complaints, and one of my roles is to establish the standards for how our health services, including hospitals, address complaints through policy tools. But it also includes the opportunity to register the things that go right. So we've heard in Lorraine's story that there were things that went right for her, and there were people who helped her in her care experience, but the things that didn't go right as well should be captured. So since January 2015, it was the end of 14, we introduced the database. We found that the consumer feedback that we've collected, and I'll talk more about the big picture numbers in a moment, are around 51% compliments. So many of the people who come to hospital actually want to share the positive experiences that they saw, or the people that helped them. And health is a very personal thing. It's a very intimate environment. It's a very caring environment. And sometimes when you've been cared for in that way, you want to celebrate with the people who've helped you achieve progress. And I know as a clinician, there's been many a time where I've been in tears with a patient who's wanted to thank me, and I'm almost in tears now thinking about it, for how much I've helped them achieve what they wanted to achieve. So as I said, 51% of our feedback is in the form of compliments. 27% is in the form of complaints, And we have a legislative requirement as the Department of Health to collect and capture those complaints and send them through an independent body, which is often called HCC. So they're the Health and Disability Services Complaints Office, and they monitor how well healthcare providers support and manage complaints. And I know PIP and the Health Consumers Council have quite a close relationship and work with HCC. So at the end of June each year, Department of Health collates all the complaints and we send a report to HCC, and they provide us, through their regulatory support of the legislation, with 10 categories of complaints that we divide our numbers into. So those personal experiences that get sent to us as complaints where things didn't go right get captured into one of those 10 categories, and there's a range of other information that supports that information that goes to HCC. So it's a legal requirement for us to return that information. For those complaints that go through, 30% of those relate to the quality of care, and my unit, Patient Safety Surveillance Unit, along with some of our other core functions, monitoring and surveilling patient safety, do produce an annual report that reports against the 10 categories, and that's publicly available on the Department of Health, Safety and Quality website. If you have a look, it's called Your Safety in Our Hands, as it has a number of components that relate to patient safety. As my other work includes looking out for when people have been harmed for their health care, and we often call those clinical incidents. And so that information is put together and reported publicly, so you can see how many complaints we receive. But also we capture, as I said, those other forms of feedback. The third category, because there's 3 of them, so compliments, complaints, is what we call contacts. So that's often just sometimes as simple as someone contacting a hospital and saying, I'm not sure when my outpatient appointment is. And those are good opportunities for us to capture against those 10 categories to monitor and see how things can be improved, whether that be at the aggregate level, that measurement added up at the Department of Health view, or whether it's the local services look to see how many times have we had a query about this. Because if you're asking me to give you information about your outpatient appointment, then obviously we haven't given you very good tools to remember it or recall it. Maybe we needed to send you an SMS. Many more hospitals are using those text messages these days to remind you about it in advance. And so things like that can be used to drive quality improvements. And so those contacts can be simple, or they can be people who prefer not to give us formal complaints. And many consumers do feel, and Lorraine mentioned the experience needs to be measured at different points in time, in that they might be concerned that if they complain during their care, that there may be some sort of adverse reaction from the staff, and that there could be recriminations if they comment about the care at that point in time. So those contacts can be informal complaints, and we do capture, we measure them, we report on them, and we try and use them as sources of improvement as well, because it's important when people prefer not to make a formal complaint, that's also giving them an opportunity to say, it didn't go right, but I'd still like to be in that middle land where I'm giving you feedback, mainly because most people want someone else not to have suffered how they had suffered. They really want to have an opportunity to improve the experience of someone else, because to some extent their experience has already happened, it's in the past. So those contacts are very important to us as well.
Sorry, Karen, I'm just going to stop you there just for a moment. I'm only just because we've started a little later than we should have, and we've only got 10 more minutes before Michael has to catch his plane.
Sure.
So we've had the perspective of the consumer talking about gathering data, and then we've had one of our health professionals who specialises in this area giving us an introduction. We'll come back to that.